Hello everyone, we move to a very interesting topic today, that is reproductive health. This session will help us understand how to control population and also infant and maternal mortality rate. Okay, so let's see what is maternal mortality rate and how can we control population. Do you think as a girl reach puberty or girl has completed her puberty period, is the girl ready to bear a fetus? Is the girl ready to give baby right at the age of 18 years? The answer is no. The mother's womb or the uterus is not ready to bear the fetus right at the 18 years of age. It requires some more time for the maturation of the uterus so that it can bear the baby, do not affect the mother as well as the infant health. But in India, because of early marriages, there are many cases of girls getting pregnant at early age and later on leads to death of the mother as well as infant. So that is maternity and infant mortality rate increasing in India because of early marriages. Also, because of you can say people not aware about the contraceptive methods. Contraceptive methods means how can we prevent fertilization of egg and sperm during every sexual intercourse. So since rural people are not aware about this contraceptive methods, there are population keep on increasing because they cannot stop the fertilization, right? Hence the population keeps on increasing which is ultimately affecting us, the environment, and hence in this session today we are going to discuss how can we prevent increasing population, how can we adapt various contraceptive methods which will lead to no fusion of male and female gametes and no fertilization, and also prevention of sexually transmitted diseases. So let's see what is this. It is said that there are various contraceptive methods. Contraceptive methods means basically these are the methods which prevent the meeting of sperm and egg during fertilization or during sexual intercourse. It prevents the meeting of sperm and egg during sexual intercourse. This prevention of conception or fertilization during sexual intercourse is said to be contraception. There are different methods: natural methods, barrier methods, intrauterine devices, oral contraception, injection and implantation, and surgical methods. Let's discuss about each of this in detail. Natural methods. Here you do not have to use anything extra. Only naturally there are chances that you can prevent fertilization. So it is said that if a couple avoids coitus means sexual intercourse. So it is said that if a couple avoids coitus during 10 to 17 days of the menstrual cycle of the girl, then there are chances that the girl will not get pregnant, because as we see the fertilization of the fusion takes place when the egg is in the fallopian tube, and the egg comes in the fallopian tube from day 10th to day 17th of the menstrual cycle. After that, the egg comes to the uterus and slowly and steadily it is coming out of the vagina in the form of blood. So if there is no egg in the fallopian tube, there will be no fertilization. Hence, if you avoid sexual intercourse or abstain coitus during day 10 to day 17 of the menstrual cycle, then there are chances that the girl will not be pregnant. In addition to this, this is withdrawal or coitus interruption. That is basically before ejaculation. I have explained in my earlier videos what is ejaculation. Ejaculation is when the males release the semen out of their body. So when the male tends to ejaculate, if the male withdraws his penis, then the male can ejaculate outside instead of the female reproductive system. If the male ejaculates outside and not inside the female reproductive system, there will be no fertilization. So these are the two natural methods, that is periodic absenteeism and withdrawal or coitus interruption. That is, not having sexual intercourse during 10th to 17th day of menstrual cycle, and withdrawal of penis before ejaculation. In addition to this, you also have one more method which is known as lactation amenorrhea. So when the mother is feeding her baby, so it is said that during intense lactation, when the baby is fully dependent on mother for about 6 months, that time there is no menstruation in women, and that time if the couple is having sexual intercourse, then there are no chances of fertilization. Hence, if you have sexual intercourse during lactation period, there are less chances of the female getting pregnant. Physical or contraceptive or barrier methods. This is the second method which we will discuss. The first method, natural methods, includes of 3 subtypes: periodic absenteeism, coitus interruption, and lactation and amenorrhea. Now we talk about barrier methods. Most of them are aware of this method. It is basically use of condoms. So you have male condoms as well as female condoms. Both the condoms are made up of upper latex sheet, and males has to wear on their penis to avoid the disruption, or you can say distribution of semen into the female body. It also prevents AIDS and sexually transmitted diseases. Okay. Then female condoms are basically diaphragm, cervical caps, walls, etc. They are inserted into the vagina to prevent the opening of cervix. So cervix do not open. If the cervix do not open, the sperm cannot reach the fallopian tube and there will be no fertilization. In that, the next method we talk about is intrauterine devices. The name itself suggests that there is something inside the uterus, right? Your intra means inside, uterine means uterus, and device means you are putting something inside the uterus of the female, right? So what is this? Copper T. There is a T-shaped structure. If you see here, it is inserted into the uterus. This releases copper ions, and copper ions tend to suppress the motility and fertilizing capacity of the sperm. Motility, basically the movement of the sperm. Suppresses means prevents the movement of the sperm, and hence the sperm cannot go to the fallopian tube and cannot fertilize the egg. If there is no fertilization, there will be no baby. In addition to this, copper ion which is present also increases phagocytosis of the sperm. Phagocytosis means basically there are cells in the uterus which will go and eat the sperm. Once the sperm is eaten, the egg cannot be fertilized and there will be no baby. In addition to this, you have Lippis loop. This is a loop which is inserted in the female body, and again this prevents the sperm from entering the fallopian tube. So intrauterine devices, the name itself suggests something we insert into the uterus. That is basically the most widely adapted methods are copper T and Lippis loop. Moving to the next method, chemical contraceptive. You might have seen the ads of iPill, right? iPill, you might have seen this ad. So that is emergency contraceptive. Basically, if a couple has unprotected sexual intercourse and the couple is having a conception that the girl might be pregnant, then the girl has to take this tablet. Basically, it's known as iPill, and this alters the hormonal balance in your body. Okay, and when the hormonal balance gets altered, basically, even if the zygote is formed, it gets disintegrated and there is no formation of the baby. In addition to this, there are other chemical contraceptives. Basically, all these chemical contraceptives alters the hormones in your body. Okay, please remember, all the chemical contraceptive alters the hormones of your body, and when the hormones, basically progesterone and estrogen levels, are altered, the girl cannot be pregnant. You have Saheli and iPill, which is a chemical contraceptive. Last but not the least, surgical methods. Now, surgical methods and intrauterine devices can be done only with the help of doctors. Okay, for these methods, you have to consult a doctor then only the method can be implemented. The difference between intrauterine devices and surgical method is a permanent alteration to the male and the female reproductive tract. You cannot reverse this. Okay, but intrauterine device, if you insert a copper T inside the female uterus, you can remove. It is not permanent. It is again the girl can become pregnant. For time being, to prevent pregnancy, you can use intrauterine. But permanently, if you do not want to become pregnant, if a girl do not want to become pregnant, then she can adopt. Girl or boy can adopt for a surgical method. Basically, it leads to sterilization. Sterilization means they can no more give birth to a baby. Hence, it is said to be it is a permanent method to prevent pregnancy. The first surgical method is vasectomy. Vasectomy is basically cutting down the vas deferens and tying them. The vas deferens in males is being cut and the ends are tied so that when the sperm is being produced, it cannot reach the urethra only. It stays here only. It cannot reach because here it is being cut. Okay, if the sperm do not reach the urethra, how it will get into the female reproductive system? Hence, that is vasectomy. Same you have tubectomy in females. Tubectomy is fallopian tube is cut and tied. So when the fallopian tube is cut and tied, but obviously the sperm cannot go to the fallopian tube, neither then egg can meet the sperm. If there is no meeting of the sperm and egg, there will be no fertilization and no baby. Okay, so tubectomy and vasectomy are the methods stop permanent pregnancy. Okay, or permanent method to prevent pregnancy. Vasectomy in males, tubectomy in females. And the last is medical termination of pregnancy. This is a biological term, medical termination of pregnancy. In general language, we call it as abortion. Okay, so if a couple by chance gets pregnant and they don't want to baby, then they have to go for medical termination of pregnancy, that is safe during the first 3 months of pregnancy, and it is not legally allowed because of female foeticide. You know, female foeticide in India, generally if we determine the sex of the baby, there are families where they abort the female child. Hence, to prevent this, it is not legally allowed, but in case of severe say you can say conditions where the couple do not want the baby, they can go for medical termination of pregnancy, that is abortion. Sexually transmitted diseases, disease or infections which are transmitted to sexual intercourse. So when a couple has sexual intercourse, there are chances that there are some diseases which can be transferred during sexual intercourse from the male to the female or female to the male. They are also known as vulnerable diseases or reproductive tract infections. These are the examples of the sexually transmitted disease. A very common disease is HIV or AIDS, which gets transferred when there is sex with multiple partners. Syphilis is another example. Gonorrhea, genital herpes, genital warts, hepatitis, all these are examples of disease which are transmitted sexually. How you can prevent sexually transmitted disease? By using condoms, that is barrier methods. Then avoiding sex with unknown partners or multiple partners. Okay, in case of doubt, you can consult a doctor and getting complete. There are treatments, but it is not treatment is not there for HIV virus, that is AIDS. Okay, hence you should avoid a sexual intercourse with multiple partners or use barrier methods which can prevent the spread of sexually transmitted diseases. This is how we can prevent or prevent the transfer of sexually transmitted diseases. We can control population, and thirdly, we can maintain or say take care of the health of female who is not ready to give birth to the baby. Okay, if you do like my videos, please subscribe my channel and click on the like button. Thank you so much.